You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. I'm super excited about this conversation and have been dying to have it for a couple of weeks now. Ivan, go ahead and introduce our guest.
Hey, I'm Ivan Zach, and I'm very excited to see back a friend of mine and one of the fabulous founders and entrepreneurs in our industry, Sebastian Gabor. He's a founder of Digitail, a startup with the mission to give veterinarians the ability to provide smarter, more effective, and personalized treatment to pets. Sebastian believes in automation and empowering people. He loves strategic thinking and solving problems. Additionally, Sebastian is a co-founder of Code for Romania, an organization leveraging technology to engage citizens in their communities. With his strategic thinking and creative problem solving skills, Sebastian has made a significant impact in both veterinary and civic tech spheres. Notably, he's an Ironman finisher, reflecting his tenacious and determined mindset. Sebastian, happy to see you back. Very excited to have this conversation, which is going to be around in artificial intelligence and chat GPT.
Hi, everyone. Great to be here. And thank you for the kind words.
I want to start with an interesting thing, and I last 3 years, I because of the COVID, I kind of dedicated time to work out more, and I was thinking about the focus because before when I looked at bodybuilders, I was thinking this is just a steroid-induced, jacked up people that just not worth my attention. That was my opinion. And then when I started focusing on any sort of sport like this, so I'm focusing on the weightlifting and stuff like that, I realized how much discipline in every aspect of your life you need to have around this, both diet, sleep hygiene, and everything to perfect what you're doing. So you doing the Ironman, what was that journey like, and how can you compare your entrepreneurial journey with the journey of preparing for Ironman?
Yeah, I totally agree with what you said. So it's definitely not easy. And my first half Ironman at that time was before Digitail, before all like super dedicated, focused on startups and having a positive impact. So in other words, I had a lot of time, and I was seeing a lot of the friends that I was meeting in the triathlon groups that they were successful people. They were doing crazy businesses. They also had a family in that same time, and also doing that. And I was like, how the heck are you doing it? And the reality is that you get extremely disciplined. You create habits. And for that, I do recommend Atomic Habits by James Clear, really great book on that one. But you just build habits, you tie them one to one, and you know that every minute in the day needs to be towards something. And this sounds really scary when you come from, I want to have time for everything and everything needs to be flexible. But then you start seeing the magic of the fact that you get more things done.
So I can't agree more. What you haven't had yet is to throw a child in the mix. So we'll see how well you'll do. Sean and I both knows how that work, but I'm sure you'll do really well. So let's dive into the topic. We're talking about AI, and I know that since last time we talked, the Digitail now is pumped with the artificial intelligence, and not just in the notion that we had, let's say, even last year with the appearance of Chat GPT and OpenAI. There's really a lot of stuff that you can do. So what Digitail now does using this technology and beats the competition by doing so.
Awesome. Thanks for asking that. So, as you know, at Digital, we've always considered how can we automate things in the practice in order to give time back to the vets and to the staff to focus on doing what they love. But AI just takes things to the next level, and we can talk about how fast things are moving. But I'll just give you a glimpse on how we broke down the use cases for AI. If you think about AI outside practice, the three big topics are that where it can do a really good job is summarizing, auto completion, and copilot. And I'll describe what this means, and then we'll go back to VetMed and how this is being used for VetMed. But summarizing, basically, if you give it a book of 100 pages, it did super quickly. It can give you the summary of that book in bullet points. Auto completion, if you've used Google Docs before, just by typing, you'll always see the next word. So that's the concept of auto completion. And Copilot is what Microsoft did because they had the early mover advantage, where if you want to use PowerPoint with Docs with everything else, you just use an assistant that leverages all the tools. So these are, when you think about AI, these are the three big buckets of where AI can do a really, really good job, because there's also areas where it doesn't do a good job. Now, when you think about VetMed, where we've seen the best use cases is dividing them in three big buckets. One is client facing, so talking with the pet parent. The other one are internal, so hospital staff, how can we help them? And the third one is trends, disease tracking, and everything else where data is really important. If you want to dive deeper, now if you look at client facing, think about all the appointments that you have in a week. and that for every appointment, you'll need to have time spent with the patient getting the history. And we call that, again, the pre-screening. Well, that pre-screening right now, you can leverage GPT and have it done before the visit. So you send your assistant, it talks with the pet parent, grabs all the information that you need before the visit, also can be helping and educating the pet parent on certain topics. And then you get all that summary straight in the medical record. Pre-screening, 5 minutes for every visit where you save time and you can now focus on doing something else. Triaging, the same. And we've compared also the evolution of GPT-3, 3.5, and 4. And I have to say that for 3.5, there was a lot of work that we had to do in order for it to not go haywire and say crazy things. But GPT-4, insane levels. If you look at also all the reports where accuracy and everything else, it's now up to 90% accuracy, which is close to a doctor in the space. So again, also insane evolution from 30% what it was a couple of months ago to now. But it can also help on triage. And it's not diagnosing, it's not replacing anyone, but it's trying to get all the information beforehand, understand the severity, and then tell the client to call instantly if it's important or postpone and book a meeting later. So it's able to do all of that today, not in 2 months. It's actually happening today.
Yeah, it's absolutely incredible, this fire hose that OpenAI has, opened up on the world. But let's take a step back, because there's a lot of people that will be listening to our episode or this episode and will have heard about it anecdotally, but not really understand exactly what we're talking about and how we even got to this point. So OpenAI as a company has launched a tool called ChatGPT. What is this tool, Sebastian? And why should people take a look at it?
Great question. So what OpenAI has built is actually called an LLM, large language model, which in other words, it's a way of interacting with data, computers in just natural language. Probably the best way to see it is that you suddenly have an assistant in the virtual world helping you take your queries and prompts and questions and finding out the answer within the whole big pond of information online. That's what it's able to do. And I would encourage anyone that has access now to the internet, just open a tab, go to OpenAI, create an account. It's free to begin with, and just try it out. Give it any task. Try to break it. Try to give it certain tasks that are really difficult, and you'll see that it's able to do it. Make it retrieve questions from books, make it retrieve answers from book or anything. It's awesomely good at it.
Yeah, and it's fascinating, and I definitely recommend you do exactly what Sebastian has said. Go and grab an account and give it a try. One way to think about it, and the way that I've been telling people about it, it's kind of like Google on steroids without the ads, at least for now. So if you want to understand something, if you want to have help co-authoring an email, if you want to outline a talk that you might want to give, if you want to write a love letter to your spouse, you can do all of these things with this thing that's called generative AI. Sebastian, where do you think this leads us in the next 6 months? Everybody's talked about this exponential growth curve that we're on around generative AI and around ChatGPT. Where do you think we're going? What are going to be some of the big surprises that we're going to see specifically in vet med as this thing finds its way into people's workday?
Exactly. So that's a great question, and trying to identify where the best use cases for AI are today in practice. And we've seen a lot of great examples. One is if you haven't seen it already on Twitter, there has been a huge case where the patient wasn't getting better. The pet parent got the diagnostics, uploaded it to GPT-4, and was able to see that it was potentially IMHA. They went back to the vet. They run more tests, and then they actually discovered and they managed to help the patient. And that's something where, again, it's 10 times better than Google because it has context, but it's not yet to the point where it can replace anyone, and it will never be. And this is super important because AI will never replace anyone in practice. However, someone using AI will.
So the way I use it, so I secretly started doing a couple of shifts in ER just to get my hand on the pulse and understand what's going on in the clinics. So I was in it was really awesome to go back, and it did feel like waking up from coma after not doing vet medicine for quite a few years, but very exciting. And actually, I used ChatGPT to create medical records, so that was awesome. So basically, I just said that, and these are the use cases for listeners. If you haven't tested it, this is what you can do. I had a 5-year-old dog presenting with a right hind lameness, most likely with a ruptured ACL, sent home on Medicam. That's the only thing that I said to ChatGPT. And in that sentence, I said, make a medical record. So it created the entire soap notes for the dog, for all the anatomical terms, which lameness, which joint, radiographic appearance, and everything that I then just copy pasted into the medical record. So it is crazy. You have to check it. There were some things that you still need to correct, but it's insane where it's moving. And, I remember when you mentioned about this IMHA, I had this, we always complain about the Google doctor. And I remember one client came in and it was, I think it was metronidazole toxicity case, which I never heard of. And then she came in and she kept telling me about this and it is treated with a diazepam. I don't remember the specifics. So doctors amongst the listeners, don't kill me for this, but I think that's what it was. And she said that you need to treat it with a diazepam. And I was like, sure, Dr. Google said again. And after a bunch of, stuff and research, that's exactly what we needed to do. So, how do you, Sebastian, leverage it? And just talk us through the use cases. Yeah, I like when you started with general understanding where AI could be used, but in the flow of working with Digitail, where you already inserted it, just user journey. Like, what would the client experience? What would the user in the clinic experience?
Absolutely. Let's go through it. So we'll start first from the pet parent perspective when they book an appointment. So it can be triage, where what the goal of the AI assistant is to get as many information as possible, so that we can summarize it directly for the staff, so that when the appointment is booked, we book it correctly, and we have all the information needed. Then, if they don't go through this journey, and if it's a client that's already booked via phone or something else, then the AI assistant goes and has a conversation with the pet parent before the visit to make sure that everything is completed, from getting all the history, educating them on the importance of what's of blood work and what's going to be done, and getting their opt-in for that. Now, once the client comes in and everything is done also with the consent forms, in practice, there are multiple use cases where this is being used. And first one is quickly assessing all the summary of the medical history. Instead of going through lists of soaps and trying to understand what happened, it can quickly grab all the summary information for you and detecting risks. And it will tell you also risk based on the profile of the patient, history, and any additional signals that came in. Then afterwards, it can help you with assisting in generating a differential diagnosis based on the presented symptoms. So now that after you have all the information in, additionally with what you also did during the exam, you put it in the system, and then AI will start prompting you with potential options that you can then choose and continue that. And then it goes even further, because now it can calculate the medication dosages and also cross verify with all the administered drugs and their efficacy on what has been already prescribed. So it does also the cross checking among that, and the list goes on.
And on and on and on. It's fascinating because me and Sebastian know each other's business quite well, and like this auto generation of medical records and stuff that we're doing, stuff that maybe Sebastian is up to. This is an evolution of this tool. But let's take a pause for a quick second and just acknowledge that we all operate inside the veterinary world, an organization that historically is slow to adopt technology and doesn't necessarily embrace the newest or latest innovations. Ivan, question for you. Where do you think veterinarians, your colleagues, your employees, will want to embrace this tool after seeing it used yourself?
It wouldn't be well, I think that the main thing that I can think of is the cut back on the medical record writing. I think that's the biggest one because that's the biggest pain in the ass. So you really don't want to do that because the so that's number one. I think it will help a lot the new grads with coming up with a diagnosis. So because it's interesting to me because I'm going through this sort of I'm doing like a shift or so a week, and then I feel like I'm having a imposter syndrome again. So almost like I'm a new grad, but I'm trying to remember stuff that I used to know. And then it actually like this is where when you throw that in, it actually helps you with this. And in fact, another case of GPT, one of the vets that is younger than I work with. So he's 2 years out of vet school. And then he had this cat presented with neurologic clinical signs and then certain blood work that which looked like a acute kidney failure, pretty kind of straightforward thing that you could think about it, but he didn't. He was on the night shift. It was 2 a.m. And then before he went to bed, he said, I remember Ivan was kind of bragging about this ChatGPT, typed it in, ethylene glycol toxicity. He never thought about that right away. So I think that guiding with the new grads with the diagnoses, faster getting them to it, and then becoming more proficient with the medical records entry, also reading the previous history, as Sebastian said. And I think that this is sort of a softball to Sebastian, is that I think that the winning software that will apply it better to help veterinarians is the one that has it incorporated nicely into existing workflows. So if you're thinking through the workflows, it's like with everything. It's like with telehealth. When COVID hit, everybody signed up for telehealth, but they didn't know how the fuck to use it because they were all like, "We subscribe for telehealth. What? Well, do you do telehealth appointments? No, it's a curbside." So if you can nicely incorporate it into the workflow that they're used to, I think that would be very, very exciting. And the art of this is what you do at Talkative, or what Sebastian is doing at Digitail, is actually plot that user journey, if you will, and insert that AI into it.
Totally agree. And this is where, with the group of the design partner group that we started with working, so with them, we first just played with ChatGPT on their website. Like, we just went and tried to see use cases, how it works. But the challenge is that to get the data from the system, that's actually the magic. Being connected to the data and to your workflow, that's where you start seeing crazy progress, and you start seeing great automation happening in the practice.
Yeah, it's so fascinating. Ivan, your example of telehealth, the number one telehealth platform in veterinary medicine is and
Zoom.
was Zoom, right? So it's fascinating, and I think the thing that we all have in common here is wanting to advance this great world that we call veterinary medicine, and encouraging everybody to just go out and play with this tool is just a fascinating opportunity to just see what it can do. And, rather than be scared of it or think that we're heading down the Terminator road, I think the best thing to do is try to embrace it and educate yourself. Sebastian, if our guests are listening, and besides just going and giving it a try, is there any resources that you direct them towards to maybe understand a little bit more about how it can apply to their day-to-day life in vet med?
Absolutely. So there are a lot of channels online where you can see more information. We've done a summarizing of this. If you go to digitail.io/AI, and you'll see a couple of resources, and also access to a Slack community where it's only people from VetMed talking about how to use AI in VetMed and what use cases it can help with.
And we'll definitely link those in the show notes below. We always run out of time. This was no exception. It was so much fun. Sebastian, we like to wrap up every episode in the same way. We need a book recommendation, a TED Talk, a YouTube, something that you find fascinating, potentially something related to GPT.
Absolutely. I would love to give you one related to GPT, but before that, I need to tell you one, which is a great book that I've just read. And first I will ask you, would you go on trips, like unlimited trip? Oh, take a full vacation, but you'll never remember anything that you've done. Would you still go on those trips?
It's an interesting question.
I'm there.
I am too. Yeah, because I'm
Yeah.
feeding off the dopamine of thinking about things in the future.
Yeah.
So I would get my high off thinking about the awesome trips I'm going to. And in my college years, I don't remember any of the trips I've done. So because I was always drunk, so it doesn't matter.
Got it. So I ran into this amazing book from Dan and Chip Heath. They're behavioral scientists, and it's called The Power of Moments. And it helps you understand how to create a memorable experience that you feel good afterwards. And one example from the book is that they go to a hotel somewhere in the US, a 3-star hotel, nothing fancy, nothing memorable. They go there, but when they go to the pool, they have a phone that they can ring it at any time. And then you have a butler coming with a tray of popsicles, and you can call that unlimited amount of number of times. And they realize that by doing that, people remember and they love that experience, and they talk to their friends. So the question is how you end up building this into your day-to-day activities. And after knowing this, and the concept of high peak end effect from Daniel Kahneman, is that anytime I go on a trip, I try to make sure that at the middle of the trip and at the end, everything is positive, because this will affect the way you remember that experience.
That's awesome. So that's the book recommendation.
Power of Moments. Yes.
Okay.
Dan
And you
Chip.
mentioned also Atomic Habits, which is also an awesome book.
Yeah.
By the way, if anybody can name the number of times that Sean said fascinating during this episode, then I'll send you a $10 Starbucks card if you'll name that and send it to me through LinkedIn without re-listening the episode. So please guess.
And
The
a tip and trick is you could use, for example, AI with transcripts to figure that out.
There you go.
100%.
And Sebastian, the second question that we ask: who would you recommend to be invited to the show?
Absolutely. So it's actually one of the people that are in the design group, and it's actually Dr. Cody from FinVet.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.